Welcome to the Deep Dive. Today we're digging into a really interesting, maybe concerning study in PLOS medicine.
Yeah, this one's led by Angela Chang from the University of Southern Denmark, with some insights from Global 50/50 too.
And the headline finding is pretty stark, isn't it?
It is. Basically, for major conditions like hypertension, diabetes, and HIV/AIDS, men globally seem more likely to be affected and, unfortunately, die from them.
But here's the twist. They're often less likely to actually seek out healthcare for these issues.
Exactly. So our mission today is to kind of unpack these differences, these sex-based health divides, and figure out why they matter so much on a global scale.
Okay, so the study uses this idea of a health pathway. Could you break that down a bit?
Sure. Think of it like the journey someone goes on with the disease. It starts with exposure to risk factors.
Like smoking or diet?
Right. Then developing the actual disease, getting diagnosed, accessing treatment, sticking to it, and then, well, the ultimate outcome, including mortality.
And the study looked at how men and women compare at each step.
Precisely. They analyzed the differences between sexes all along that pathway.
So what was the big picture finding on who's actually getting sick and dying from these specific conditions?
Well, the data showed pretty clearly, across a lot of countries, that males generally had higher rates of both getting these diseases, hypertension, diabetes, HIV/AIDS, and also higher mortality rates from them.
Wow. That points to a really significant disparity.
It really does, a global one.
But it's not just about the disease rates, is it? You mentioned seeking care.
Yeah, that's a crucial piece. The research found evidence suggesting men were, in some contexts, less likely to go see a doctor or a clinic.
And maybe less likely to follow through with treatment if they did get diagnosed.
That too.
Yeah.
Less likely to stick with the prescribed treatments. And, that behavior gap likely contributes to the higher death rates we see.
Okay, what about the risks before getting sick? Did they see differences there?
They did. Some interesting patterns based on sex. For instance, men were more likely to be smokers, whereas women showed higher rates of obesity in the study populations and also reported more instances of unsafe sex practices.
Interesting. Did the study explain why those differences exist?
Not really the why. They noted the correlations, these different risk profiles, but didn't dive deep into the underlying social or cultural reasons in this specific paper. That link is important, though.
Got it. Now, this is alarming. You mentioned differences in care received, even if people sought help.
Yes, that was quite striking. For hypertension, they found differences in care received between males and females in 200 countries.
200. Wow.
Yeah. And 39 countries for diabetes, 76 for HIV/AIDS. It means in a lot of places, men and women aren't getting the same standard of care, even for the same condition.
That really underscores the need for better data, doesn't it? Broken down by sex.
Absolutely. That's a major call from the researchers like Angela Chang and also from groups like Global 50/50. You need that sex-disaggregated data.
Why is this so critical?
Because without it, you can't see these different journeys. You don't know who's falling through the cracks in prevention or who's not getting the right care once they're sick. These differences persist all along that health pathway Chang mentioned.
And there's a distinction here, too, between biological sex and gender, right? The social roles.
Exactly.
Yeah.
Kent Buse and Sarah Hawkes from Global 50/50 highlighted this. They argued that many of these differences we're seeing, well, they're probably driven more by socially constructed gender roles.
Like ideas about masculinity, perhaps, or how men versus women are expected to deal with illness.
Precisely. Things like toughness, reluctance to admit vulnerability, or maybe even just different life pressures affecting access to care. It's likely not just about biology.
So knowing all this, what's the path forward? What should public health folks be doing?
Well, the clear message is that one-size-fits-all doesn't work. Health strategies need to be much more tailored.
Tailored how?
They need to acknowledge these sex differences up front. We need interventions specifically designed to encourage men, for example, to engage more with preventative services and stick with treatment.
And also address those different risk factors we talked about.
Yes, absolutely.
Yeah.
Interventions need to reflect what the data shows about who is engaging in which risky behaviors.
Okay, so let's recap. We're seeing some really significant, frankly concerning differences based on sex for these major global diseases. It goes way beyond just who gets sick.
Right. It affects risk, diagnosis, treatment adherence, the quality of care received, and ultimately survival.
And a lot of this might be tied up in societal factors, not just pure biology.
That seems to be a key implication, which leads to a final thought for you, our listeners.
Yeah.
Thinking about how much gender roles might be influencing health. what are some of the less obvious ways this could be playing out in your own life or in your community?
That's a really powerful question. What does this make you wonder about how we usually talk about and approach health in general? Something to definitely mull over.